Do you, or maybe does someone you know, enjoy helping people and spending time at the beach? Well, the Summer Lifeguard program might be a great opportunity. Hi, and welcome to Volusia Magazine. I'm Amber Patterson. On today's show, we'll bring you some important information about Volusia County's Beach Safety Division's Summer Lifeguard program. Not only that, but we'll also hear about a triumphant victory for one happy sea turtle named Alice as she returns to her ocean home. Then Business Beat reporter Joanne Magley takes us for a look at a new support group for local entrepreneurs. And in the studio, Community Information Director Dave Byron sits down for an in-depth discussion with Volusia County Health Department Director Dr. J.Sorensen. Those segments, news, and more coming right up on Volusia Magazine. Stay tuned. Hundreds of beachgoers lined the beach to cheer on Alice as she made her triumphant return to the sea in Ponce Inlet. The 155-pound loggerhead sea turtle had undergone 9 months of rehabilitation in the Marine Science Center's Turtle Hospital before receiving a clean bill of health. Alice arrived at the Marine Science Center in June of 2014 after stranding on the beach near St. Augustine.
Well, originally she came in extremely emaciated, anemic, debilitated is what we call it. But in addition to what we see a lot of times with these loggerheads, she also had a pneumonia. But because of the type of the bacteria, you have to do combinations of drugs. So I went and looked at human medicine for the similar type of pneumonia and used a combination that we use in humans. This was a unique case. As far as I know, it's never been successfully treated before, and so it's something that hopefully we've learned, and that's what we try to do with every one of our patients is learn, and so we can treat the next one better. So hopefully we've had a couple of these types of bacterial infections before and been unsuccessful. So hopefully we can take what we've learned from this turtle and be able to apply it to any future cases that come in and be able to be successful with them also.
Alice showed off her powerful flippers as she quickly made her way from her handlers to the ocean, pausing once to look back before disappearing into the surf. The Marine Science Center's Bird Hospital recently played a key role in 2 baby great horned owls returning them to their mother in their nest in Port Orange. The owlets had dropped 80 feet after the nest had crumbled. Marine Science Center staff brought the owlets to the Bird Hospital, where they were rehydrated and fed mice for a few days. The staff reconstructed a nest with a sturdy platform and called on Florida Power and Light to help with the placement of the owlets and their new home. Both parents watched the entire operation and swooped in to greet them afterwards. Great horned owls are nocturnal creatures commonly found in woods throughout North America. They're often seen on fence posts at dusk, and they're distinguished by their long ear tufts, large bodies, and wide yellow eyes and deep hooting voices. Since opening in 2002, the Marine Science Center has cared for more than 16,000 sea turtles and more than 1,100 gopher tortoises, freshwater turtles, and snakes. The Mary Keller Seabird Rehabilitation Facility at the Marine Science Center has received more than 12,000 birds since it opened in 2004. For more information, you can visit marinesciencecenter.com. One of the best summer jobs around for physically fit, responsible high school and college students is being a Volusia County lifeguard. It's not too late to apply for a summer job as a part-time lifeguard with Volusia County's Beach Safety Division. The final swim tryout will be April 11th at 7:30 a.m. at Daytona State College. Volusia County's lifeguards have a long distinguished history of service, watching over the 8 million people who visit the county's beaches every year.
This is a great summer job, whether you're in high school or whether you're in college or whether you just need a summer job. You can come down here, you get the chance to talk to people, you get the chance to be ambassadors of the beach. You get to come down here and work sitting on a tower and swimming and really being able to make a difference in somebody's lives when they're struggling or they're having problems in the water. You can make a difference in whether they survive or not.
Applicants must be at least 16 on or before June 1st and be able to swim 500 meters in under 10 minutes. They also must be able to swim 50 yards in under 30 seconds and run half mile in under 3 minutes 15 seconds. Starting pay is $9.70 an hour for EMT certification and $9.37 an hour without certification. Those who meet the requirements must attend training classes in March or April and complete a 40-hour first responder CPR course. Laura Warner started out as a part-time summer lifeguard with Volusia County and is now a senior lifeguard and an emergency medical technician.
Well, I actually started out as a part-time lifeguard back in 2001 when I was just finished my junior year in high school, and it was my first summer job and I fell in love with it on the spot. I love being outside and just helping people in general. There's no feeling like it. Just being able to, whether it's rescue someone from the water or unlock somebody's vehicle, being able to help people is just one of the truest rewards you can have.
For more information, you can visit volusia.org/beach or you can call one of the numbers on your screen. Passenger traffic at Daytona Beach International Airport increased 4% during February 2015 compared with last February. During February, 48,202 passengers flew in and out of the county-operated airport. This compares with 46,346 travelers recorded in February of 2014. For the 12 months ending February 28th, passenger traffic also increased 4% from 607,024 last year to 634,168 this year.
I think you're going to see some more increases, particularly this month as well, because we've noticed that there's a lot more seats in the month of March this year than there was last year. So I think the passenger traffic could well increase. Of course, it depends on people if they buy the tickets, but I think the momentum is there in the marketplace here in Daytona Beach and in Volusia County, and I think you're going to see more people here at the airport.
The airport also will be working with JetBlue Airways over the next several months to complete the marketing plans and facility upgrades needed to support recently announced nonstop service to John F. Kennedy International Airport beginning next February. For information, you can go to flydaytonafirst.com.
Many of the items you throw out are not biodegradable and take centuries to break down. Reduce, reuse, recycle are separate but interconnected ideas that minimizes waste and saves money. The process is simple. The best way to reduce waste is to avoid creating it. According to the EPA, on average, Americans each produce over 4 pounds of trash per day. To help reduce trash, switch from plastic to reusable bags. Next, reuse items destined to be discarded. Get creative in reusing trash to reduce waste and save money. Finally, recycling takes items from materials that are discarded and turns them into new products. For example, plastic bottles can be recycled into carpet and benches. Many communities make recycling easy by offering programs such as curbside pickup. Newspaper, plastic bottles, glass, and pop cans are all recyclable items. Reduce, reuse, recycle decreases the amount of waste people create. Help keep our earth clean. Make the choice to reduce, reuse, and recycle today.
For more information on Volusia County's recycling program, you can visit volusia.org and select recycling from the drop-down menu. Entrepreneurs in Volusia County have a new support group that serves as a way to help grow their business. Reporter Joanne Magley has more in today's Business Beat.
This is an in-garage floor model, probably one of the most popular.
1 Million Cups is a volunteer-only organization that engages entrepreneurs in communities around the world. Art Zimmett, a certified business consultant at the Small Business Development Center at Daytona State College, is one of the organizers of 1 Million Cups Daytona Beach.
The 1 Million Cups program is a Kauffman Foundation program. So the Kauffman Foundation is the premier entrepreneurial foundation in the country and the world. And they created this and have basically been franchising, for lack of a better word, the idea across the country.
The featured entrepreneur provides a short presentation on their business, some challenges they are facing, and some successes that they've had. In return, the audience asks questions and also provides tips and advice
You might want to consider writing a blog out there
based on their own business experience.
We ship a truckload.
Entrepreneur Sarah Dougherty is the owner of Lifeguard Storm Shelters and recently presented at 1 Million Cups Daytona Beach.
It was great. Several little golden nuggets we were able to take away, and met some really nice people and neat people who do lots of different things, and I think we'll all be able to help each other.
LifePod is based in New Smyrna Beach and has been in business for 2 years.
Traditionally, the criteria is the business has to be at least at the minimum viable product stage. They've had to have made a sale. Also, we tend to make the cutoff at about 3 years of business being in existence. However, we've hosted businesses that are older. It all depends on how it fits into the entrepreneurial space that we're trying to build.
Across the country, the 1 Million Cups program takes place every Wednesday morning from 9 to 10. In Daytona Beach, the program is offered at Sweet Marley's Coffee Shop on Beach Street. Zimmet says the program has been well received since its debut in November of 2014.
For our group, it's one of the smaller towns that Million Cups is in. We really love the intimate feel of the coffee shop. It is a program called 1 Million Cups, and those are cups of coffee, so it's natural that a coffee shop would host it. But we are growing out of that space, and we're going to keep it here in the downtown area. We like that feel. It's an entrepreneurial area. But we don't want to grow too fast. We're not going to go into a large auditorium because then you lose that intimate feeling, and you lose that feeling of we're going to talk to each other afterwards and connect.
For more information on 1 Million Cups Daytona Beach, visit www.1mcdb.com. For the Business Beat, I'm Joanne Magley.
Well, now it's time to join reporter Stephanie Strong for this report from the Volusia County Health Department.
What is the state of homelessness in Volusia County?
About 1,500 people, men, women, and children, are homeless on any given day in Volusia County. That includes those that are living in tents, cars, encampments, or other places not fit for human habitation, and those that are living in emergency shelters or transitional housing programs that are provided for the homeless.
According to Lisa Hamilton, there is an increased focus on assisting homeless veterans, those who served their country and are now without adequate housing. Hamilton says there is also a major concern for children who are homeless.
The number of young people showing up at shelters has increased dramatically in the last 10 years. Of course, everyone can understand that as a result of the economic problems our country's had and the unemployment rate faced by young people, more young people between the ages of 16 and 22, that's the federal designation for homeless youth. They know that number has skyrocketed, and youth shelters have been reporting turning away kids.
And it's also a struggle for homeless college students.
We know, for example, that there are many kids trying to make it through college while they're homeless. They're living in cars, they're sharing dorm rooms, they're sleeping on couches, they're doing whatever that they can to get through school. And it's become so prevalent in our country in the last 10 years that there's a term for it. It's called wildcatting.
The Homeless Coalition is involved in special efforts to identify the homeless and organizations to serve them. Help is available.
Volusia County is very fortunate in its provider community. There are 8 organizations that provide housing for the homeless, and those are emergency shelters, transitional housing programs, and also what we refer to as permanent supportive housing for individuals who have severe mental or physical problems and are not going to be able to go back to work and support themselves in an apartment. We have funding that provides lease money for them. And then our agencies provide wraparound case management.
Please call 211 for help or information. For Volusia Magazine, I'm Stephanie Strong, Public Information Officer for the Florida Department of Health in Volusia County.
For more information about this and other health-related issues, you can always log on to volusiahealth.com. Let's head into the studio to join Community Information Director Dave Byron as he sits down with Dr. Bonnie Sorensen of the Volusia County Health Department.
Well, thank you, Amber, and hi, everyone. The Robert Wood Johnson Foundation at the University of Wisconsin has released its annual health rankings of counties across the United States. Today, we'll find out how Volusia County compares with the other counties nationally, as well as the counties in the state of Florida. Our guest today is Dr. Bonnie Sorensen. She's the director of the Volusia County Health Department. Dr. Sorensen, how you doing?
I'm great, Dave. Thank you.
Hey, we announced that you were retiring, and I thought that was going to be our last interview.
That's
so
right.
we snagged you for one more time before
before
you go enjoy your
problem.
retirement.
No
The Robert Wood Johnson Foundation does this county by county analysis every year. Give us kind of an overall description of what this is all about.
Well, the Robert Wood Johnson has funded the University of Wisconsin to basically create a snapshot of health of every county across the country once a year, and to post it on the internet.
Right.
So anyone can go out and look at any county across the country to look at what their health snapshot looks like. In addition, they've actually ranked the counties within each state.
Okay.
In Florida's case, we have 67 counties, so we have a ranking within Florida, 1 to 67, 1 being the healthiest county, 67 being the unhealthiest county.
And tell us about some of the criteria that the Johnson Foundation uses to make this comparison. What do they look at?
They have data. Obviously, the data has to be available in every county across the country for them to be able to do this analysis. But every year they're changing the data a little bit. And what they display for us is the overall health outcome of the county, and that's a snapshot of what the health is today.
Right.
But they also display data showing the factors that influence health, and that's basically a picture of the health tomorrow.
Right.
Because the factors will influence health in the future, and they give us both of those rankings.
So in your opinion, although I guess there are something like more than 3,000 counties across the United States, in your opinion, is this data comparable or measurable? Is it fair to compare Volusia County with a county in Idaho?
It is, because they use data that's available everywhere.
Okay.
National data oftentimes that is collected by national organizations about all the counties across the country. So we're all being measured by the same data, and therefore it does make it very comparable.
Well, give us a few examples of some of the things that they look at and compare. I mean, what do they look at?
Well, first of all, for the overall health outcomes, they look at what's called premature deaths.
Okay.
Premature deaths, all of us are expected to live to be age 75. And if any of us dies before age 75, that's a premature death.
Okay.
So what they do is look at all the deaths in all the counties across the country and calculate how many years of life were lost prematurely in every county. And the premature deaths are a major reason for our health overall. And nationally, the numbers of premature deaths have been decreasing every year, whereas in Volusia, we've seen an increase in the number of premature deaths over the years until this year.
And we've talked in the past, we're going to talk about Volusia's ranking in a minute, but we've talked in the past about the fact that there is a correlation between a health of a community and the wealth of a community.
Yes, you're exactly correct. As we look at the data, oftentimes the influences on health are not only our own personal behaviors as to whether we smoke or drink or are physically active, etc., but also where we live. The socioeconomic conditions in which we live impact our health. So if a person is not educated, they oftentimes will not have a good job. They will end up in poverty. Their children will end up in poverty. They may take up risky behaviors, and therefore the more healthy a person is, generally, the more access to healthy options that person has and the more healthy they are.
You know, one of the things that's surprising, I've learned because we've done this, and I guess this is the sixth year for the study.
Right.
One of the things that you've impressed on me is the fact that facilities and access to health hospitals and that sort of thing is important, but it's not the most important factor.
Exactly. Healthcare is not health. Health is more than healthcare, and research has shown that healthcare only contributes 20% of our health, whereas health behaviors contribute probably 30% to our health. Socioeconomic factors contribute 40% to our health, and the physical environment contributes about 10% to our health. So add all that up, and that accounts for our health, but healthcare is only 20%.
All right, so there are 67 counties in the state of Florida, so Volusia would be compared with the other 66. How are we doing?
Well, unfortunately, we have been on the low side for all 6 years, but each year we've gotten a little bit worse. This year we ranked 45 out of 67, which seems a little worse than last year, in which we ranked 43. But when we look at the data, that are in that ranking, it turns out that the number of premature deaths that we've had have gotten better this past year. The other numbers have all stayed the same. So although we went from 43 to 45, I think we actually improved. And what's happened is that other counties have gotten better faster. So it appears that we've gotten worse when in reality we've actually gotten a little better.
Okay, so, but anyway you look at it, 45 out of 66 in our case, it puts you in the bottom third if I did the new math right.
Right, the new math, the core math, exactly. We are mediocre minus, I like to say, and that's, I think, also in light of the fact that Florida's health compared to other states. This past year, Florida ranked 32 out of 50.
Wow.
So we're already in a state that's not doing so hot, and we are, unfortunately in the county that's not doing so hot in the state that's not doing so hot. So it's kind of a double whammy for us here.
Well, let's look at the state of Florida for a minute. Now that you mentioned that, I mean, we live in a place where we have good weather, we have access to a lot of recreational opportunities, a lot of good things to do, good hospitals, good roads, that sort of thing. Why does Florida rank in this bottom half? You would think that would be the opposite.
Well, we do have recreation opportunities and beauty and paradise, but too many children are uninsured, too many adults are uninsured, too many people, adults in particular, are still smoking. Too many folks binge drink in Florida. We've got prescription drug abuse in Florida, unlike any other state. So there's factors that influence the health that are adverse in Florida. And it may be because of the type of people that we have here. It's because of our environment. Colorado has the reputation for being the most physically active state. There's a culture in Colorado that it's cool to be physically active. We don't have that culture here in Florida.
Interesting.
We're kind of retiree and resting, retired.
Wow. So when you look at Volusia County, bottom third, 45, you're finding golden nuggets in the report. So what are the influences in Volusia County or the areas that maybe we need to look at to boost this ranking?
Well, if we look at personal behaviors, we can look at the smoking rate. We have improved. The number of adults who smoke in Volusia has improved over the last 6 years, but we're still significantly above other counties. 18% of adults are still smoking, which is kind of amazing when we've been preaching for 20 years that, the adverse effects of smoking.
Probably the single most worst thing you can do for yourself that's legal.
Exactly. There's more deaths caused by smoking in this country than any other cause. So that's a biggie. We also have too much high-risk sexual behavior in Florida. We continue to get worse in that area. We don't have enough physical activity, despite the fact that we live in a beautifully recreationally oriented state and county. We don't have enough people who are motivated to take advantage of that physical activity. And of course, in Volusia, we have other areas in our county that are full of convenience stores and don't have a real grocery store. So even if a person wants to make a healthy choice with eating healthy, they either don't have access to it or can't afford it.
Well, speaking about can't afford it, You know, you have told me in past interviews that one of the factors that influences Volusia's ranking is poverty or a lower socioeconomic part of our society. And as you were saying that many of the other Florida counties have gotten better, it would seem to me that that's a product of the economy getting better. I mean, is there a correlation there?
The economy is getting better, and socioeconomic conditions influence health. Right. One of the things that really drags us down is our graduation rates. We have a graduation rate of 62% of kids in high school end up graduating. Wow. In St. Johns County, which has the healthiest county, 82% of kids in high school in St. Johns County graduate. Wow. Those folks are going to get better jobs. They're not going to be in poverty and not be uninsured. But
boy, that's a dramatic difference.
It is dramatic, and it's kind of, you know, the folks that are here in Volusia County. Right. So all those things can improve. Certainly our economy is improving, and I like reading about the fact that we have $1 billion worth of cranes sitting in Volusia County. Right. And although we may have higher paying construction jobs for a couple years as a result of those cranes, if all that construction results in low wage jobs, then we're not getting anywhere. Right. We're full of low wage jobs here in Volusia County. Right. We have a lot of people who are below the level of poverty, and we've got folks who are working poor. Right. That they can't afford to live adequately here despite their job. So we need to work on that.
All right. Well, I was going to say, 6 years worth of data now. You're seeing some trending now in this data. What do we got to do? I mean, what are we going to have to do in the future to try to make some headway here?
Well, I'm optimistic. The more of us that are knowledgeable about how the socioeconomic condition impacts health and then therefore drags down the health and value of our community, the more we can all work together and synergize. We have our Healthy Volusia group now looking at the data carefully, particularly the county health rankings, and saying, gosh, what can we do to improve our community so that all of us can enjoy a high-quality life and make healthy choices?
Well, where can people get a hold of this report, Dr. Sorensen?
It's out there online at countyhealthrankings.org. And every county is up there. There's interactive. You can put your county and someone else's county in there. You can just kind of data mine for yourself.
And St. Johns County, #1 in the state of Florida.
Number one.
And one of the smaller counties, I think, in the
Union County, kind of Union Bradford, where the prisons are. They have the worst health, and it's been persistent year after year.
Wow. Well, I want to thank you for sharing the information with us. Good data, and it's good to see that the community is coming together to look at the data. And that's all about setting priorities, and maybe we can make some progress here.
Setting priorities and, resources.
Our guest today, Dr. Bonnie Sorensen, Director of the Volusia County Health Department. And with that, we'll go back to you, Amber.
Thanks, Dave, and thank you for watching Volusia Magazine. If you have any questions about the show, you can feel free to give us a call at any of the numbers you see listed here, or you can log on to volusia.org and click on the News tab at the top of the screen to find us. Incidentally, you can find the County Council's meeting calendar there too. In fact, you can use volusia.org to find out about meeting dates, workshops, topics of interest, activities, and how you can become involved. And we hope you won't forget to listen to Volusia Today. That's Volusia County Government's weekly public radio broadcast. Volusia Today airs every Tuesday, Wednesday, and Sunday mornings on the local radio stations you see on your screen. For Volusia Magazine, I'm Amber Patterson. Have a wonderful evening.